Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
In this edition of Health Today, we tell you about a life-threatening condition that is sometimes treated far too lightly. You may have experienced these symptoms: heartburn, that is a burning pain or discomfort that may move from your stomach to your abdomen, your chest, or even your throat. Or perhaps a sour or bitter tasting acid backing up into your throat or mouth, bloating, nausea. These are the symptoms of acid reflux or GASTRO-ESOPHAGEAL REFLUX DISEASE or GERD.
At the bottom of the swallow pipe is a group of muscles which normally would contract and prevent gastric contents from going back up into the esophagus. As you realize, when you swallow, everything is supposed to go right down until the exit point. Gastro-esophageal reflux disease is basically when those stomach contents are not leaving the stomach into the small bowel, so there's some of them reflux. So you have one, the sphincter is not relaxing, and allowing contents to go back into the esophagus, or the stomach is not emptying enough or fast enough, so you allow the gastric contents to remain there.
That's Dr. Ryan Kelman. Every week, he sees between 5 to 10 patients, from babies to the elderly, suffering from acid reflux. It's a common condition that is chronic and it has no cure. According to Dr. Kelman, everyone has acid reflux, but when the irritating symptoms are persistent, it must be evaluated.
To call it GERD, or gastro-esophageal reflux disease, I would want to know the frequency of it, if it has occurred more than once. Because if it only occurred once, you can't really put a diagnosis of GERD on it. It has to be 2 or more episodes in 1 week. And you can use the number of episodes, which is the frequency, to tell you what if it's mild, moderate, or severe actually. 2 attacks per week, we call that mild. Greater than 2, we call that moderate. But you may have somebody having upwards of 8-10 episodes of GERD per week. They would be severe cases.
Common risk factors for GERD include obesity, pregnancy, diabetes, peptic ulcers, smoking, and alcohol. In some people, certain foods can trigger reflux.
Smoked meat, basically, they can irritate it, but it's also how you prepare the meat. If you're frying it and putting a lot of seasoning in the meat, you realize that can have an impact on the symptoms.
Diet is often one of the first things acid reflux patients will have to address.
For instance, not eating late. They normally put a time of 7 p.m. because you're also looking to see if this person is having GERD at night. There's a difference between GERD in the night and GERD in the day, so you also have to differentiate that.
What's the difference then?
GERD at night is more associated with complications. In other words, that GERD at night is more related to erosion of the lining of the esophagus, which is the swallow pipe. And then you're looking at raising the head of the bed. We normally use an 8-inch block to elevate the head of the person's body so that the stomach is again influenced by gravity. Because when you're laying flat, the stomach is not influenced by gravity, and that allows contents to flow back into the swallow pipe or the esophagus.
For more severe cases, medication is prescribed.
You can use Pepsid, one of the ones that we use a lot, which is we call a H2 antagonist. That is something that prevents the secretion of acid. And then you can do things like over-the-counter Tums, and then the real drug of choice will be a proton pump inhibitor. One of the very common ones that you have here in Barbados is omeprazole, also marketed under Alocid. And you have Nexium. Those are some of the proton pump inhibitors, and those are really the drug of choice.
It's usually common for sufferers to use over-the-counter drugs for relief. But Dr. Kelman warns users should not use these medications for more than a week.
If it were me and I was getting constant nighttime burning and having to use Tums more than once, well, more than 2 days, I will seek the doctor's advice. The reason for that is that esophageal disease, gastroesophageal reflux disease, is associated with Barrett's esophagus, and it is also associated with cancer of the esophagus, something called adenocarcinoma, and that is increasing throughout the world. So you pretty much have to have it addressed so that you avoid these complications.
While many don't see acid reflux as a serious illness, it can have a significant impact on the lives of patients. Dr. Kelman is particularly worried that while Barbadians can identify symptoms, they are unaware of serious and potentially life-threatening complications.
The lining of the esophagus, which is swallow pipe, may actually change its form and become something called Barrett's esophagus. So the type of epithelium or the type of lining actually changes to accommodate the irritation. And that of itself is a precancerous or a lesion that may ultimately lead to cancer of the esophagus. So one must always put it in the back of their mind that this condition, although being very widespread, has some serious consequences. There is an asthma associated with gastroesophageal reflux disease.
Silly says there's no need for panic. If you've been diagnosed with acid reflux disease, it means learning how to manage and prevent your symptoms.
Correct eating is not only what you eat, but also the frequency of how you eat. For instance, not having a heavy meal and going and lie down, that also would impact on obesity, which will also impact on gastroesophageal reflux disease. So there are little things like that that you can actually address, decreasing the amount of spices in the food. You know, in the Caribbean, like a lot of garlic and onions in our food to make it tasty. And we have a little problem with greasy foods, which also cause a problem of relaxation of the lower end of the swallow pipe. So limiting these things in the diet, fatty foods, alcohol, smoking cessation, can lead to a decrease in the incidence of gastroesophageal reflux disease.
Here are some other tips to help you along the way.
Eat 6 small meals instead of 3 big meals. Don't eat or drink anything for at least 2 hours before going to bed. Avoid foods that are known to trigger heartburn. Don't wear clothing that constricts the stomach. Don't smoke. Don't drink. Relax.